3 months before she came to see me, Marianne stopped driving at night. She was 74, proud, sharp, and stubborn in the way many capable women are after a lifetime of taking care of everyone else. She told me the lane lines looked blurry, her feet felt thick and strange on the pedals, and every grocery trip ended with one hand gripping the cart because her balance felt just a little off. What scared her most was not the tingling in her toes. It was the sentence she whispered next. "I'm taking vitamin B12 every morning, Dr. Sarashia. So why do I feel like I'm disappearing anyway?" If that sounds familiar, stay with me, because Marianne's mistake is incredibly common, and the fix is not what most people expect. When Marianne opened her purse, she pulled out a cheerful little bottle of berry-flavored B12 gummies. She had bought them because the label promised energy, memory, and nerve support. She had been faithful with them for almost a year. She felt she was doing something smart, but her numbness was creeping upward. Her fatigue was worse by late afternoon, and she had started forgetting simple things, like whether she had paid the water bill. If you take B12 and still feel tired, foggy, unsteady, or prickly in your hands or feet, I want you to tell me in the comments, "Still not feeling right." I read those comments because they often reveal the pattern before the lab work does. Here is what I found when I looked closer. Marianne had type 2 diabetes and took metformin. She also took omeprazole most days for reflux. She had no idea those details mattered. Her standard B12 blood level was not dramatically low, so she thought she had ruled out a deficiency. But symptoms do not always read the same textbook your blood test does. That is where many older adults get caught off guard. The problem is not always that you are ignoring B12. Sometimes the problem is that you are taking it like a younger person with a different stomach, different medicines, and different risks. I am Dr. Alina Sarasia, and I want to explain this the way I explain it in clinic. Vitamin B12 helps your body make red blood cells, protect nerves, and support thinking, memory, and energy. Think of it as part insulation, part wiring support, and part delivery system. Your nerves are like electrical cords. They need a healthy coating called myelin to send clear signals. Without enough usable B12, that coating can fray. Then the message from your brain to your feet becomes fuzzy, slow, or distorted. That is when people start describing tingling, burning, clumsiness, weakness, or that strange cotton under the feet feeling. Now here is the piece most people never hear clearly. Getting B12 into your mouth is not the same as getting B12 into your cells. Food-based B12 is tied to protein. Your stomach acid helps separate it. Then, your body uses a helper called intrinsic factor, so the small intestine can absorb it properly. As we age, that system often gets less efficient. The National Institutes of Health notes that vitamin B12 deficiency affects somewhere between 3% and 43% of older adults, depending on how it is defined. That huge range tells you something important. This problem is common, slippery, and easy to miss. If you are over 60, your stomach may not be doing what it did at 40. Some older adults make less stomach acid. Some develop atrophic gastritis, which means the stomach lining thins and works less well. Some have autoimmune pernicious anemia, where the body attacks the cells needed to help absorb B12. Some have had stomach or intestinal surgery, and many take medications that change the picture. Metformin can lower B12 over time. Acid-suppressing drugs like proton pump inhibitors and H2 blockers can interfere with absorption from food. None of this means those medicines are bad or that you should stop them on your own. Please do not stop a prescribed medicine because of this video. It means you may need a smarter B12 plan while you stay under your clinician's care. Let me pause here because this next part changes how people think about the whole topic. Taking B12 The wrong way usually does not mean one tiny mistake with the clock or the brand name. It means you are treating B12 like a simple supplement problem when it may really be an absorption problem, a diagnosis problem, or a medication problem. That distinction matters. If this is already making you rethink your routine, type "I need a better plan" below, because once you see the pattern, you cannot unsee it. One of the biggest misunderstandings is the idea that a normal B12 level always means you are fine. It does not. A 2022 CMAJ review pointed out that about 5% of adults over 60 have true deficiency, while roughly 20% have marginal levels. A 2024 expert consensus on B12 deficiency went even further and said clinical symptoms deserve the highest priority because some people with neurologic or blood-related symptoms can still have serum levels that do not look dramatically low. In plain language, the lab can look acceptable while the person in front of me clearly does not feel acceptable. That is why, when symptoms and risk factors line up, clinicians sometimes look at methylmalonic acid or homocysteine too. Those are metabolic clues that may reveal a functional shortage. They are not perfect, and kidney disease can affect methylmalonic acid, but they can be very useful when the story is murky. This is exactly what happened with Marianne. Her first number looked ordinary enough to reassure a busy person, but her symptoms kept talking. Her metformin use mattered. Her reflux medicine mattered. Her age mattered. And the form and dose she was taking mattered too. Her gummy gave her a small amount of B12, but not nearly enough to overcome the barriers she had. That is the overlooked part. For many seniors, the question is not, do I take B12? The better question is, am I taking enough in a way that fits why I might be low in the first place? There are a few habits that quietly make this worse. The first is relying on a low-dose multivitamin or candy-style gummy and assuming it is enough for symptoms like numbness, gait changes, or brain fog. Those products may be fine for general nutrition in some people, but they often do not work as treatment. The second is taking B12 only when you feel run down, as if it were a cup of coffee in vitamin form. B12 is not a rescue spark. Your nerves and blood cells need steady support, not random bursts. The third is assuming all fatigue belongs to aging. It does not. Neither does new imbalance. Neither does new memory trouble. The fourth is missing the medication connection, especially if you have taken metformin for years. A 2021 review found the prevalence of deficiency among metformin-treated patients ranged from about 6% to 50% across studies, and risk rose with higher dose and longer use. That is not a side note. That is a flashing sign. And here is one more mistake that deserves more respect than it gets. Some people try to outsmart the situation by taking folic acid or a B complex without actually clarifying the B12 issue. The trouble is that folate can improve certain blood changes, while the nerve damage from B12 deficiency keeps moving quietly in the background. In other words, the anemia can look better while the nerves keep suffering. So, if you have tingling, numbness, burning feet, poor balance, or mental slowing, do not let a normal blood count make you complacent. Neurologic symptoms can happen even when anemia is not obvious. I remember another patient, a retired school bus driver I will call Walter. He was 71 and kept telling me his feet felt like they were wrapped in cardboard. He laughed when he said it, but his wife did not laugh. She had watched him start touching the walls in the hallway at night. Walter had been taking a regular multivitamin for years and assumed that covered him. It did not. His B12 was sitting in that frustrating borderline zone, and his story fit the pattern. Long-term metformin, poor appetite after an illness, and worsening numbness. What helped Walter was not hype. It was putting the clues together early enough that the nerve symptoms had a chance to calm down. If you know someone whose walking has changed and everyone keeps shrugging, send this video to them, because sometimes a family member notices the drift before the patient admits it. I also want to clear up one marketing myth before we go further. You will hear people say food B12, sublingual B12, spray B12, methyl B12, or injection B12 as if one word automatically wins. Real life is messier. B12 in supplements and fortified foods is already in free form, so it does not need to be cut loose from food protein first. That is helpful for older adults, but helpful does not mean magical. The right option still depends on whether the problem is low intake, poor adherence, drug effects, stomach disease, bowel disease, or severe symptoms that need faster correction. That is why I get nervous when channels promise one best form for every senior. Your biology deserves more respect than that. Before I tell you what actually works best in daily life, let me ask you something simple. Do you feel more bothered by low energy, numb feet, or brain fog? Put just one word in the comments: energy, numbness, or fog. I ask because those symptom patterns often point us toward how urgent the evaluation should be. Now, let's talk about what actually helps. And I want to do this honestly, not theatrically. I do not like miracle talk. I like useful talk. The first thing that helps is matching the route of B12 to the situation. Many seniors assume injections are always best. Others assume pills are always enough. The research is more nuanced than that. A 2020 Spanish trial followed 283 adults older than 65 with B12 deficiency and found oral and intramuscular treatment led to similar normalization of B12 levels over time. A 2024 meta-analysis that pooled 13 studies and 4,275 patients found oral, sublingual, and intramuscular routes all increased B12 levels without major clinical differences between them. That means the best route often depends on severity, cause, adherence, cost, and comfort. So when do I think harder about shots? I think harder about them when someone has severe neurologic symptoms, serious anemia, known pernicious anemia, major stomach surgery, bowel disease affecting absorption, or a fast decline that I do not want to gamble with. NICE guidance updated in 2024 says clinicians should not delay B12 replacement when deficiency is strongly suspected in someone with megaloblastic anemia and neurologic symptoms, especially signs of spinal cord involvement. That is a big deal. If you suddenly have worsening numbness, walking trouble, major weakness, confusion, or falling, that is not a "let me wait 6 months and see" situation. And please do not wait for a fall, a car scare, or a frightening bout of confusion before you ask better questions today. But if you do not need urgent injections, high-dose oral treatment can work very well for many people, even when absorption is not perfect, because a small amount can still get in by passive diffusion. This is where many seniors finally get traction. Not with a cute bottle, not with a sprinkle dose, with a plan. In practice, many guidelines and reviews support daily high-dose oral B12, often around 1,000 micrograms or more for treatment. But the right dose for you depends on the cause, your labs, your symptoms, and your medical history. That is why I will never tell you to copy your neighbor's dose just because she feels better. The second thing that helps is choosing the plan based on the cause, not just the symptom. If you are vegan or eat very little animal food, the issue may be low intake. If you take metformin, the issue may be medication related. If you have autoimmune pernicious anemia, the issue is lifelong impaired absorption. If you had gastric bypass surgery, you are in a different category altogether. These are not trivia details. They change what a sensible plan looks like. If you know why you are low, you stop guessing. And when people stop guessing, they usually stop wasting months. The third thing that helps is respecting timing and consistency without becoming obsessive. B12 does not need a dramatic ritual. It needs regularity. I usually tell patients that if they are using oral therapy, taking it consistently matters much more than turning it into a perfect ceremony. Morning works well for many people simply because they remember it. And some people say late night doses make them feel a little too alert. That is not universal, but it is common enough to notice. What matters most is that you actually take the plan as prescribed, long enough to judge it fairly. The fourth thing that helps is knowing what progress should feel like. This is where patience saves people from giving up too early. Blood counts may improve within weeks. Energy can start shifting in a few weeks too, though not always dramatically at first. Nerve symptoms often take longer, months, not days. If the problem has been going on for a long time, some symptoms may improve only partly. I tell my patients to watch for the first quiet wins. Less burning at night, fewer stumbles in the hallway, better steadiness getting out of a chair, less afternoon collapse. Those changes matter because they tell us the body is responding. Here is a practical way to approach this if you are watching today and wondering what to do next. First, write down your symptoms in plain language before your appointment. Not, "I feel off." Write, "pins and needles in both feet for 4 months." Or, "more forgetful since winter," or "sidey, warter, war sidey, or sidey, or warper, or non-diede. Need the railing now when I did not before. Second, write down every medicine that may affect the picture, especially metformin, omeprazole, pantoprazole, famotidine, or any long-term acid blocker. Third, note whether you eat very little meat, fish, eggs, or dairy, or whether you had stomach or bowel surgery. Fourth, ask your clinician whether testing should include more than a single serum B12 level if symptoms and risk factors strongly suggest a problem. And fifth, if you start treatment, track response over weeks and months, not over one dramatic afternoon. That little notebook can be gold. This is also where many seniors finally relax because they realize they do not have to solve it alone at the vitamin aisle. You do not need to memorize every pathway. You just need a clean question. Could my symptoms, medicines, or stomach issues be affecting B12? That one question often opens the right door. And if your doctor has already told you your level was fine, but you still feel clearly worse, it is reasonable to say, "I understand the number, but my symptoms are changing. Is there another way to look at this?" That is not being difficult. That is being thorough. Marianne's turning point did not happen in 48 hours. It happened in layers. First, we took her symptoms seriously instead of worshiping one lab number. Then we asked the better question. Why would a 74-year-old woman on metformin and omeprazole absorb and use B12 the same way a healthy 30-year-old would? She would not. Her clinician moved her to a treatment strength plan and followed her response. We also reviewed whether she still needed her reflux medicine at the same intensity, but that review happened carefully with her own doctor. Again, I want to be crystal clear. We did not tell her to stop prescribed medication on her own. We adjusted the strategy around the reality of her body. By about 6 weeks, her afternoon energy was steadier. By a few months, she told me she no longer felt that electric buzzing in her feet every night. Her balance was not perfect, but it was better. She had enough confidence to walk into the store without gripping the cart like it was a life raft. That is the emotional difference people rarely talk about. It is not just about a vitamin. It is about getting pieces of yourself back. If you have ever felt your world shrinking because your legs, memory, or energy no longer feel trustworthy, you know exactly what I mean. I also want to protect you from another trap. Not every case of fatigue, memory trouble, or neuropathy is B12 deficiency. Diabetes itself can damage nerves. Thyroid disease can drain energy. Spine problems can affect walking. Sleep apnea can wreck memory and stamina. Depression can slow thinking. Iron deficiency can mimic some of the same complaints. So if you take B12 correctly and nothing changes, that does not mean you failed. It means the story may be bigger, and you deserve a full evaluation. B12 is powerful when it is the problem. It is not magic when it is not. There are a few groups I want to speak to directly before we finish. If you have kidney disease, ask your clinician how to interpret follow-up testing, because some markers can be harder to read. If you are on metformin, ask whether you should have B12 checked periodically, especially if you have new neuropathy, weakness, a sore tongue, or unusual fatigue. If you use acid-suppressing medication for months or years, bring that up too. If you have pernicious anemia, a history of gastric surgery, significant bowel disease, or unexplained neurologic symptoms, please do not self-manage this casually. And if you use blood thinners or have reasons injections are difficult, tell your clinician, because route and safety planning matter. So what is the real takeaway today? You are not taking vitamin B12 wrong just because you picked the wrong bottle once. You are taking it wrong if you assume B12 works the same for every senior, every stomach, every medication list, and every symptom pattern. The right approach is more personal than that. Take the symptoms seriously, take the cause seriously, take the root seriously, and take consistency seriously. That is how this stops being a guessing game. If Marianne's story felt a little too familiar, write "This sounds like me" in the comments. If you are over 65, tell me your age too, because I always like to see who is building a smarter health plan with me. And if this video helped you understand why a supplement can fail even when you are trying to do everything right, subscribe and stay close. I make these videos because seniors deserve health advice that respects both the science and the real life behind it. In my next video, I want to show you the early signs that nerve damage is not just aging and the simple questions I wish every older adult would ask before it gets worse.